This is the femoral puncture needle. It has got a bevel tip. Can you see the bevel tip? Can you see the bevel tip? Yes. Okay. Can you see the bevel tip? So the idea is that the bevel tip always should face the upper. It should face upwards, not like this or not like this. Clear? So it should always face upwards. So how do you puncture is hold the puncture needle like this. Puncture needle like this. Suppose this is the artery. Hold it like this. So when you puncture the skin, it will go and it will go. So the idea is the bevel tip should be facing upwards. So once it has gone inside, suppose if it is facing downwards, once you puncture, the blood will start coming out at the systolic pressure. So always puncture at 45 degree in the line of the artery. Once it punctures, with these two fingers stabilize the needle and very carefully insert this is the, what is this? This is the J-tip wire. The J-tip wire means the tip is always curved like this. So the idea of a J-tip wire is it is atraumatic. The moment it comes out of this, it will become a J. It will not traumatize the blood. So you have to use this introducer to introduce. Otherwise it will be like this. It will be difficult to introduce. Put it like this. Introduce it like this, and very slowly push. And once it goes inside, convert this 45 degree, lower the puncture needle a little bit so that it will be in line with the artery. So you puncture at 45 degree, and the moment you start pushing in the J-tip wire, you lower it a bit. Always stabilize the needle with these two fingers, the thumb and the forefinger, so that the needle should not move, because it is just entering. If you are not careful, it will come out or counter puncture. And once you are clear like this, you push like this. So once you go in, the moment it comes out, it will go in easily. See, it will go in easily. So once it is inside the artery, do the fluoroscopy and identify that it has gone inside. Once it has gone inside, press the artery like this, and you can withdraw the needle and hold the wire. So it comes out like this. Now the wire is inside, and this is the puncture spot. So once it is like this, you can clean this, and this is the fiber sheath, femoral sheath. So it has got an introducer, and the sheath. So you can get the help of someone to put it. Because always your hand should stabilize the artery, and otherwise the blood will start leaking from the side. So press the artery like this with your two fingers so that artery doesn't leak, and then slowly push it in. So once the sheath will go in first, the introducer will go in first, and once it reaches here, you can take the small knife. So if you want, you can put a small nick here with a knife, and with a rotating motion like this, like now. So don't push it, because what will happen is if you just push it, the tip of the sheath will get blunted. It will flare. So what you have to do is, without that, you just rotate and push. Rotate and push. Rotate and push. And once it is inside, you can take this out. And once you take it out, you can introduce it completely. Here it will not go because this is a bladder catheter and it will not go easily. The next step is, once the sheath completely is inside, what you have to do next is take a syringe, attach here, and then aspirate. So when you aspirate, there should be a free flow of blood. If there is any occlusion, that means the tip is touching somewhere, or it has dissected the vessel. So always before injecting, aspirate and see whether there is a free flow of blood. Once there is a free flow of blood, what you have to do is close it and just flush it and see if there is any clot or anything. Then take 2500 ml, 2500 units of heparin, inject it, and then what should be the next step? Take contrast and take a shoot, aspirate always, see that no air is coming, then take an injection and take a DSA of the femoral artery. So we should very carefully check that DSA to see if there is any leak, if there is any arteriovenous fistula, any abnormality, and whether the puncture is at the correct position, and whether the the puncture is adequate and perfect. So always check for minor leaks. If there is a minor leak, what will you do? You have to keep pressing at this point for 2 to 3 minutes. And after 2 to 3 minutes, again take a check shoot, and invariably the leak would have stopped by that time. So always do the check angio of the femoral after the femoral puncture. Very carefully look in the DSA for any small leak at the puncture site. If there is a leak, press very firmly at that site for 2 to 3 minutes. Do a repeat angio and then only proceed with the next step. Now once this is over, you can flush this with the normal saline. Once the contrast is over, you can again take this, flush it, aspirate always, and then flush it properly. Close it and keep. And always be very careful that this complete tubing from here till here is full of saline only, not of blood. So if there is any blood lying here, that will clot inside and that will occlude the femoral artery. So always during the whole procedure, fill this whole area with saline and see that there is absolutely no blood in this area.